So going to prescribing, I wouldn't want to spend so much time on this. Prescribing is also one of the requirements in your third year of training. It's quite technical, and I think it's something that needs a whole new its own block of time. But just know that in your third year of training, you're going to do something called prescribing. It's specific. In fact, it is specific for the second part of your third year. It's just looking at your prescribing history and assessing yourself and telling yourself what you have done well and doing that. I wouldn't want to bore you so much with that, but as I said, it's done in your third year of training, and then you do a log entry. Prescribing is also one of the one of the areas in which I also used the capability of team working, because to do the prescribing you have to ask people in your IT department or your secretaries to get you your 50 most recent prescriptions. Okay. And that will mean communicating with other members of the larger team in your GP surgery. Is done in your GP surgery. So it's one of the places I also utilized team working, really. It was also one of the places I also utilized data gathering, because you're going to collect data of 50 prescriptions you have done and assess it. You will know more about this as you go higher in training, and it will also be part of your course and your demo. Okay, so for this, I also used organization management and leadership a lot. And then because you're going to assess yourself and see how you can improve in your prescribing, I also use performance learning and teaching. So it's a case of practice makes perfect. The more you practice in writing these entries, for me, I didn't have a problem. I loved engaging with my portfolio. I love to write, but some people found it quite difficult. But I feel if it's something, if you get ahead of it from the beginning of training and you don't leave it to the end, it doesn't look as cumbersome as it is. So I will leave prescribing here, and I know that you will see a lot more of this in your demo and in your course. But obviously, the RCGP website will always be there for you to have a look as you get to that level to see what needs to be done in prescribing. So let's go back to the portfolio.